Ross Diagnostics, Pakistan. And before starting our session, I would like to call Dr. Ramesh Iqbal Menon for recitation of Holy Quran. Dr. Ramesh.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم قل هو الله أحد الله الصمد لم يلد ولم يولد ولم يكن له كفوا أحد صدق الله العظيم.
Now, I would like to invite Dr. Amir Ramzan, Assistant Administrator of Diagnostic and Research Laboratory, on behalf of Working Vice Chancellor Professor Kiran. Dr. Amir Ramzan.
Assalamualaikum. I, Dr. Amir Ramzan, Assistant Administrator and Consultant Oncologist, Diagnostic and Research Laboratory, on the behalf of Deputy Vice Chancellor, LUMS, Professor Dr. Kiran. Warmly welcome to all of you and member of Pakistan Medical Association under Ramadan. Today we have arranged this CME with the collaboration of Ross Diagnostic. We are extremely grateful to Ross Diagnostic for arranging such a wonderful educational activity for the doctors of Ramadan. Respectable doctors, Diagnostic and Research Laboratory was established in 2002 in Hyderabad. Now we have more than 40 state laboratories and collection points in all over the state. Dear doctors, our aim is to provide quality reports on time with subsidized rate on the doorstep. For this purpose, we need your cooperation, support as well in future. Thank you very much.
Thank you, sir. Now, I would like to invite Dr. Kiran, Associate Professor and Consultant Hematologist of London University of Medical and Health Sciences, for a talk on CBC interpretation. Dr. Kiran.
Bismillahirrahmanirrahim. Assalamualaikum. I am Dr. Kiran, Associate Professor at Department of Pathology. I am also a consultant hematologist at Diagnostic Research Lab, LUMS. I am also the course coordinator of PS Medical Laboratory Technology Program, and I am also the additional director, Postgraduate Medical Center at LUMS. Today, we are here with the collaboration of Ross Diagnostic. आज हम यहाँ हैं और इनकी बदौलत आज हम ये CME आपके सामने लेके हैं. So today the talk which is assigned to me is the interpretation of CBC. So before going to the actual talk, I want to know from all of you why CBC is so important. इम्पोर्टेंट क्यों है कि हर डॉक्टर जो है अपने टेस्ट में CBC एडवाइस करता है. Why it is so important? Actually, most of the doctor, when the patient comes to you, you will advise the first test, which is the CBC, because आप ये देखना चाहते हैं ये रिसर्च आया था patient your health status चाहिए, whether the patient is normal, whether the patient is anemic or have infections, or if the patient has bleeding, so it is due to low platelet count or the platelet count is normal. तो आप सबसे पहले CBC एडवाइस करते हैं एक तो ये जानने के लिए कि व्हाट इज द स्टेटस ऑफ द पेशेंट. इसीलिए आज हमने ये टॉपिक रखा है ताकि में से जिनको CBC की प्रॉपर इंटरप्रिटेशन नहीं आती। हम हीमोग्लोबिन देख के ट्रांसफ्यूजन एडवाइस करते हैं despite of knowing that what is the underlying cause of anemia, whether it is iron deficiency anemia or megaloblastic anemia, हम ये नहीं देखते कि कॉज क्या है, वी एडवाइज द ट्रांसफ्यूजन, लेकिन उसमें हम ट्रीटमेंट के थ्रू भी एनीमिया को रिकवर कर सकते हैं। सो टुडे आवर एम इज टू इंटरप्रेट द CBC ताकि हमें पता चले कि व्हाट इज द कॉज ऑफ एनीमिया, व्हाट इज द कॉज ऑफ लो प्लेटलेट काउंट, और उसको फिर हम उस तरीके से डायग्नोज करके ट्रीट कर सकते हैं। So these will be the content of my presentation. First is the overview of CBC. What is the importance of CBC and what are the different parameters of CBC? How important is CBC? इस सवाल का जवाब जानने के लिए सबसे पहले हमें ये पता होना चाहिए कि what is complete blood count and why CBC we are advising to patient. What are the different various parameters of the CBC and what are the variations that occur in the CBC and what these variations can tell us and how these variations affect the system and the care of the patients. So CBC it is an expensive test, ठीक है, बहुत ही cheaper test है and it is a powerful tool which provide information about blood, bone marrow status, हमारे bone marrow में red cell production, WBC production and RBC platelet productions, they are normal or low, ठीक है, and it is also giving us information about the health or the disease state of other organ of the body. एंडोक्राइनल एब्नॉर्मलिटी है, hemostatic defect है या कोई और cause है, this will be also this information can also be provided by the CBC. So it is one of the commonly ordered routine blood tests and it is the calculation of the cellular or formed element of the blood, RBC, WBC and the platelet. These calculations are generally determined by the special analyzers and that analyzer will analyze the different component of the cells within a minute. So why we are advising? We are advising the CBC to know whether the patient is anemic or has hemoglobin decrease. It is also used to detect the bone marrow aplasia. It is also helpful for the diagnosis of the nutritional deficiency, thrombocytopenia and the cause of thrombocytopenia, autoimmune conditions, any infections or parasitemia can also be detected by the peripheral film examinations. Malignancy and the response to the drug or chemotherapy can also be diagnosed with the help of peripheral review of the peripheral film. So what are the different various parameters of the CBC? So parameters are divided into three categories. ऐसा 3 categories में divide करना है. RBC parameters, WBC and the platelet. RBCs are further subdivided into hematocrit, hemoglobin, mean corpuscular volume, mean corpuscular hemoglobin and mean corpuscular hemoglobin concentration. WBC is further subdivided into neutrophil, eosinophil, basophils, monocyte and lymphocyte. So this is the normal reference range of RBC, hemoglobin, PEC cell volume, MCV, MCH, MCHC in normal adult male and female. सारा हम आगे डिस्कस करेंगे. This is the normal RBC. So what is the RBC? Actually RBC red blood cell is a count of actual number of the red blood cells in a person's sample of the blood. RBC is produced in the marrow and definitely it requires iron, copper, cobalt, different vitamins, B12, folate, and this is regulated by a hormone erythropoietin which is secreted from the kidney. This RBC is also regulated by thyroid hormone and the androgen. So if there is a deficiency of the thyroid hormone or endocrine abnormality, so the patient can also be present with the anemia. Normal lifespan of RBC is 120 days, and the function of RBC is to transport oxygen, which carry oxygen from lung to the tissue. So count of RBCs depend upon the age. It is varies between adults and the newborns. It is also varies between the sex, altitude, exercise, and those who are the smokers. So it is varies between the smokers and the non-smokers. So this is the normal value of the red blood cells in newborn, children, adults, and male and female. The causes of the decreased red blood cell production, that may be the cause of anemia. So the decreased RBC count can be occurred due to blood loss. That can be acute blood loss, or that can be chronic blood loss due to hemorrhoids, due to heavy menstrual bleeding, and hepatomesis or other cause. And a decreased red blood cells production can also occur due to decreased RBC production. Either या तो marrow में defect का, bone marrow defect का, या देखिए contents and like B12, iron, folate, they are deficient. Mineral production effectively. Apart from this, there may be the cause can be marrow deficiency within the red cell aplasia और viral जो है EPV virus, Epstein-Barr virus, hepatitis virus, these all can also directly suppress the bone marrow, or even the marrow is infiltrated with the cancer cells. Then the causes of increase, normally the destruction of red blood cells, the lifespan is 120 days. But if the RBCs are destroyed prior to 120 days, and marrow's capacity is, our marrow is unable to compensate that anemia, so that can lead to the low RBC count. So causes can be inherited or it can be acquired. The inherited causes of anemia could be membrane defect, hereditary spherocytosis, hereditary leukocytosis, enzyme deficiency, glucose 6-phosphate dehydrogenase deficiency, pyruvate kinase deficiency, or hemoglobinopathies, thalassemia, sickle cell anemia. The causes of acquired hemolytic anemia could be autoimmune or alloimmune or non-immune causes. So non-immune causes में infections है, malaria की कोई, टीका, paroxysmal nocturnal hemoglobinuria, snake bite. These all are the causes of non-immune hemolytic anemia. So causes of increased red blood cell production. अभी जैसे डिहाइड्रेशन बढ़ेगी, गर्मियाँ बढ़ेगी, लूज मोशन, डायरिया होगा, तो पेशेंट हमारे पास काफ़ी आते हैं हाई हीमोग्लोबिन, RBC काउंट एंड हेमेटोक्राइट के साथ. So polycythemia in which there is a abnormal increase in the RBC count, that can be physiological, that can occur in the people who are living at the high altitude, because they take shower, corridor, mountain areas, they are hypoxic. High altitude terrain they are hypoxic. The erythropoietin increased amount released in and this will lead to the normally increased red cell count. But when RBC count patients we are considered as a patient. So the pathological causes of polycythemia could be primary, which is the malignant disorder, primary polycythemia vera, and it can be secondary due to COPD, congenital heart disease, pulmonary hypertension, poor blood supply to the kidney due to renal artery stenosis or other tumors. Then hemoglobin, it measures the amount of oxygen carrying protein in the blood. The normal value in the newborn is 15.5 to 24.5 gram per deciliter. In adult male, it is 13.5 gram per deciliter to 16.5. While in the female, it is 12 to 15 gram per deciliter. Hematocrit is the percentage, which is also called as red cell volume. It is the percentage blood volume consisting of red blood cells. In male, it is 40 to 50%, while in female, it is 38 to 42%. We are applying the rule of 3 on these 3 parameters: RBC, hemoglobin, and hematocrit. जब भी आपके पास CBC आती है, if you have the RBC count, you will multiply it by 3. That should be the hemoglobin. अगर आपके पास किसी क्वालिटी रिजल्ट आ रहे हैं, किसी क्वालिटी लैब से आपने रिपोर्ट करवाई है और हीमोग्लोबिन RBC काउंट आ रहा है आपके पास 4, 12. So 12 है या 12 से 1 or 2 above है और 1 or 2 नीचे है, it means the results are accurate. And then you have to multiply the 12 with the 3, that would be the hematocrit. So causes of high hematocrit would be polycythemia, can occur due to dehydration, low oxygen content heart disease, or the causes of low hematocrit can occur due to anemia. Other red cell indices can be NCH, NCB, NCFC, and the red cell distribution bit. NCB, mean corpuscular volume, it is the measurement of the average size of the RBC. It can be calculated by hematocrit and the RBC. If you divide the hematocrit with the red blood cell count and you will multiply with the 100, the MCV is available. Normal MCV is 80 to 100. If MCV is below 80 femtoliter, then the size of the RBC are microcytic. While if the MCV is 80 to 90 femtoliter, it means that the size of the RBCs are normal. But if the MCV is more than 100 femtoliter, it means they are macrocytic. If the MCV is low in your CBC, you have to know the cause of what are the causes of microcytic anemia. The causes of microcytic hyperchromic anemia are iron deficiency, thalassemia, sideroblastic anemia, lead poisoning, and anemia of chronic disorder. The causes of macrocytic anemia could be megaloblastic or non-megaloblastic. अगर MCV 100 से above है, hemoglobin 6-7 है, don't go towards the transfusion. You have to give them B12 or folate. B12 folate deficiency is the common deficiency in our setup. तो हमें cause देखना है कि what is the cause of anemia. If there is a non-megaloblastic macrocytic anemia, then the patient would be alcoholic, liver disease, aplastic, or with thyroid disorder. NCH is the calculation of an average amount of oxygen carrying hemoglobin inside a red blood cells. और ये भी हम if we are dividing the hemoglobin with the red cell count and multiply it with 100, then we can calculate the MCH. Normal MCH in adult male and female is equal 27 to 34 picograms. Now it is increased in the macrocytic anemia in infants and the newborn babies. Then mean corpuscular hemoglobin concentration, it is the calculation of average percentage of hemoglobin inside a red cell. कि hemoglobin के अंदर जो है red cells के अंदर hemoglobin content कितना है, जितना content होगा इतनी hemoglobinization इतनी है. और central जो पैदार है, this is the cause. If the MCH is below 32 gram per deciliter, it means the RBC is hypochromic. Hypo means less, chromic means color. RBC को जो color दे रहा होता है, that is the hemoglobin within the RBC. So if the MCH is below, then the RBCs are hypochromic. But if the MCH is normal, then normochromic, color is normal, central पैदार जो नजर आ रहा है, this is the normal RBCs, ठीक है? If you see this in this slide, then there is the less color in the RBC, they are hypochromic. While this is the hyperchromic RBC, the increased NCHC can be observed in patients with the hereditary spherocytosis, in infant and newborns, and those who have the RBC degradation. Red cell distribution width is the quantitative measure or numerical expression of anisocytosis. जितना वेरिएशन होगा साइज में आरबीसीज के वेदर आयरन डेफिशिएंसी एनीमिया है या हीमोग्लोबिन पैंतीस है, तो डिस्ट्रीब्यूशन आरडीडब्ल्यू जो है उतना ही आपके पास रेट्स मिलेगा. So RDWCB is the ratio of standard deviation to the mean corpuscular volume, and normal value of RDWCB is 11.5 to 14.5%. अगर RDW आपका रेस है, it means there is the variation in the sizes of the RBC. SD. The normal SD value is 35 to 45. तो ये सब चीजें हम आरबीसी पैरामीटर्स के बारे में डिस्कशन किया क्यों ये जानने के लिए कि whether the patient is normal or anemic. Anemia is defined as decreased oxygen carrying capacity of the blood due to decreased hemoglobin, hematocrit, and RBC with reference to that age and sex. So anemia, it is not a disease, but it is a sign of underlying disease. अंडरलाइन कोई डिजीज है, पेशेंट कोई ब्लीड कर रहा है जिसकी वजह से आयरन डेफिशिएंसी हो रही है, पेशेंट थैलेसीमिया का है जिसकी वजह से आयरन डेफिशिएंसी एनीमिया हो रहा है, पेशेंट को न्यूट्रिशनल डेफिशिएंसी है उसकी वजह से. सो इट इज द साइन ऑफ अंडरलाइन डिसऑर्डर एंड इट्स वेरी इंपॉर्टेंट फॉर ऑल प्रैक्टिशनर टू नो हाउ टू इवैल्यूएट इट एंड हाउ टू डिटरमिन इट्स कॉज एंड. So we are classifying anemia according to the pathophysiologically and morphologically. Pathophysiologically, anemia is classified into either due to blood loss, ठीक है, acute blood loss है और chronic blood loss. If the patient has acute blood loss, patient present with normocytic normochromic anemia. But if the patient has chronic blood loss, underlying cause कोई hemorrhoids हैं, हेमेटूरिया है फाइब्राइड की वजह से, या फिर जो है CLT है, हेमेटोक्रिसिस चल रही है फ्रॉम लास्ट 6 मंथ, ठीक है, या देयर मे बी द अदर अंडरलाइंग कॉज, तो पेशेंट प्रेजेंट विद द आयरन डेफिशिएंसी, माइक्रोसिटिक हाइपोक्रोमिक एनीमिया सेकेंडरी टू क्रोनिक ब्लड लॉस. Then the cause can be anemia can occur due to decreased RBC production. अगर हमने hemoglobin चेक किया, hemoglobin is below with reference to age, reticulocyte count करवाया, if the reticulocyte count is low, it means the patient has decreased RBC, cause is decreased RBC production. अब वो bone marrow aplasia हो सकता है, aplastic anemia हो सकता है, सिर्फ आरबीसी एनीमिया हो, डब्ल्यूबीसी और प्लेटलेट काउंट नॉर्मल हो, रेड सेल एप्लेजिया के साथ प्रेजेंट कर सकते हैं. देन इट कैन बी द न्यूट्रिशनल डेफिशिएंसी, आयरन B12 फोलेट डेफिशिएंसी, ठीक है. तो कोई भी कॉज है, हमें उस कॉज को सर्च करना है, वी हैव टू ट्रीट दैट कॉज. इफ डिक्रीज आरबीसी इज प्रोडक्शन इज ड्यू टू इन्फिल्ट्रेशन ऑफ मैरो बाय कैंसर सेल्स. पैराफिन फिल्म जब हम रिव्यू करते हैं तो उसमें ब्लास्ट सेल्स या नॉर्मल सेल्स हमें विजुअलाइज हो जाते हैं, तो वी कैन गो कॉज को सर्च करके वी हैव टू ट्रीट दैट कॉज. देन द थर्ड कॉज कैन बी इंक्रीज आरबीसी डिस्ट्रक्शन. वी हैव ऑलरेडी डिस्कस्ड इंक्रीज आरबीसी डिस्ट्रक्शन which is also called as hemolytic anemia, could be inherited or it could be acquired. तो अगर न्यू बॉर्न बेबी है 6 महीने में, 7 महीने में या 1 ईयर में प्रेजेंट कर रहा है, यू शुड थिंक अबाउट देयर शुड बी इनहेरिटेड कॉज. कोई इनहेरिटेड कॉज आए, माँ पीमा को एक डिजीज आई या थैलेसीमिया है, हेरिडिटरी स्टीनोसाइटोसिस का, अगर वो पेशेंट एंटी मलेरियल ड्रग का पोटेंशियल हेमोलिसिस आया and may die child, so you should think about glucose 6-phosphate dehydrogenase deficiency. But if the patient is present at 20 year, 30 year, 40 year and the Coombs test is negative, it means there is some alloimmune cause of hemolytic anemia. Sorry, non-immune cause of hemolytic anemia. So this is the morphological classification of anemia. It is based on NCV and MCH. If the NCV and MCH is below 80 and MCH is below 27 picogram, the deficiency would be, and cause would be iron deficiency anemia, thalassemia, sideroblastic anemia, and anemia of chronic disorder. अब जब CBC हमारे पास आती है और MCV और MCH आया, हेमोग्लोबिन भी लो है, ठीक है, RBC काउंट भी हमारे पास अवेलेबल है, और हमारे पास किसी ऐसी लैब से रिपोर्ट आई है कि नीचे हमारे पास कमेंट नहीं लिखे हुए, तो आप खुद अपनी क्लिनिक में बैठ के भी कैन ऑल्सो डिफरेंशिएट वेदर इट इज थैलेसीमिया और IDA सिंपली बाय अ फॉर्मूला व्हिच इज कॉल्ड मेंटर्स इंडेक्स. एमसीवी को आप डिवाइड करेंगे आरबीसी काउंट से, अगर आपका रिजल्ट 14 से बिलो आता है, इट मीन्स द पेशेंट हैज thalassemia minor, ठीक है. But if you divide MCV with the RBC count and the answer is above 13, it means patient is iron deficiency. Patient has iron deficiency anemia. With the help of this, you can also differentiate. अगर morphology नहीं भी है, तो सिर्फ आपके पास CBC का एक पैरामीटर्स आ गए हैं, so you can differentiate whether it is thalassemia or whether it is iron deficiency. Then if the MCV is 80 to 95 femtoliter and MCH is above 27, the cause can be mixed deficiency, iron भी हो, B12 भी हो, anemia of chronic disorder, acute blood loss, or renal disease, and infiltration by cancers or patient is taking chemotherapy. If the MCV is above 95, above 100 से above हो, it means that there could be the two differential diagnosis, whether it is megaloblastic anemia or it is non-megaloblastic. अब megaloblastic में हम जब when we are reviewing the peripheral, there should be the presence of oval necrocytes, and there is the hypersegmented neutrophils can be seen on the peripheral. फिर हम एडवाइस करते हैं bone marrow. क्यों? क्योंकि उस मेगालोब्लास्ट में मिलते हैं, and megaloblastic anemia is commonly occurs secondary to B12 and folate deficiency. तो हम क्या करते हैं कि we have to sort out the cause of B12 और folate. एक पेशेंट रेनिना डेफिशिएंट है, डाइटरी डेफिशिएंसी है, स्ट्रिक्ट वेजिटेरियंस होते हैं जो कि डेफिशिएंट होते हैं, या डाइट ले रहा है मेल एब्जॉर्प्शन है, ठीक है, मेल एब्जॉर्प्शन की वजह से भी. तो वी हैव टू सी द कॉज ऑल्सो. हमारे पास पेशेंट आया, हमने मीथोकोबाल के इंजेक्शन दे दिए, पेशेंट ठीक हो गया, ये हमारी सक्सेस नहीं है. वी हैव टू सी द कॉज ऑफ. न्यूट्रिशनल है, आपने B12 के इंजेक्शन दिए, सही हो गया, ठीक है, लेकिन न्यूट्रिशनली वो न्यूट्रिशनल डाइटरी डेफिशिएंसी नहीं है और अंडरलाइन कोई कॉज है, डायरिया रह रहा है परसिस्टेंट, altered bowel habit है, you have to sort out the cause of that deficiency. Because of non-megaloblastic anemia, जो लोग पीते हैं उनमें भी नेक्रोसिटिक एनीमिया होती है और पीने के बाद जिगर तो जरूर खराब होता है. So alcoholic, liver disease, myelodysplastic syndrome, aplastic anemia, and hypothyroidism. They are the causes of non-megaloblastic necrotic anemia. The second parameter is the white blood cell count. Total WBC count is 4,000 to 11,000. If the WBC count is below 4,000, we will label it as leukopenia. But if the WBC count is above 11,000, we call it as leukocytosis. So leukocytosis के causes क्या होते हैं? Infections हो सकते हैं और बिनाइन. सबसे पहले तो हमने बिनाइन कॉज देख लिए, ठीक है. इट कैन बी अंडरलाइन कोई इन्फेक्शंस है, पेशेंट इज टेकिंग ड्रग्स लाइक स्टेरॉइड्स, ठीक है, कोई एलर्जिक मैनिफेस्टेशन है, यू डोंट, अभी हमें पता नहीं है कि इज़ोफिल बढ़े हुए हैं, न्यूट्रोफिल्स बढ़े हुए हैं, बेसोफिलिया है, क्या है, वी आर जस्ट टॉकिंग अबाउट द WBC काउंट, ठीक है. तो हमें उन सब चीज़ों को सोचना है. इफ द WBC काउंट इज बिलो 4,000, इट मीन्स पेशेंट हैज अंडर प्रोडक्शन. बोन मैरो में कोई डिफेक्ट है, इधर मैरो की प्रोडक्शन नहीं हो पा रही, या पेशेंट कोई कैंसर का है तो कीमोथेरेपी मिल रही है, और मैरो इज इन्फिल्ट्रेटेड बाय हेमोपोएटिक और नॉन हेमोपोएटिक यूरिन्स. देन वी हैव टू लुक फॉर द डिफरेंशियल काउंट, ठीक है. अक्सर जो हम गलती करते थे, जब मैं स्पेशलिस्ट नहीं थी, हेमेटोलॉजिस्ट नहीं थी, तो हम भी जब वार्ड ड्यूटी करते थे परसेंटेज देख के कहते थे परसेंटेज इज अबव 70% neutrophilia. No, we have to see the absolute count of the differential. Absolute neutrophil count is 2,000 to 7,000, and absolute lymphocyte count is 1,000 to 3,000. Absolute basophil count is 0.01 to 2.1. Absolute monocyte count is 0.1 to 1,000. Absolute eosinophil count is 0.04 to 0.5. हमें एब्सोल्यूट काउंट देखना है, एब्सोल्यूट काउंट देख के डिसाइड करना है इफ देयर इज द न्यूट्रोफिलिया इट मींस बैक्टीरियल इन्फेक्शन, स्टेरॉइड्स लेना है या जो भी कॉज है कॉज को सॉर्ट आउट। इफ देयर इज द एब्सोल्यूट लिम्फोसाइटोसिस और बच्चा नहीं है, मे बी अंडरलाइन इन्फेक्शन कोई लिम्फ